Hi, I'm Judy. I'm from Cancer Council Victoria.
And I'm Rachel and I'm from BreastScreen Victoria.
Cancer Council Victoria and BreastScreen Victoria are working together to develop partnerships with disability advocacy organisations to increase access and participation in cancer screening for people with disabilities.
The purpose of this project is to improve partnerships between cancer screening programs and the disability sector.
The partnerships will help to ensure that people with disabilities are aware of how to access cancer screening in Victoria and also build capacity in cancer screening.
The model works on the understanding that people with disabilities know the best way to communicate with and engage with their own community.
The partnerships are also really beneficial for BreastScreen Victoria and Cancer Council Victoria to inform their practices and strategies to be more accessible and inclusive. Through the partnership, we've funded a lot of peer education activities. So peer education projects involve where BreastScreen Victoria and Cancer Council Victoria have trained people with an intellectual disability in cancer screening messages, and then they run their own education sessions with their own communities.
We've also been involved with the development of plain language posters, and Cancer Council and BreastScreen Victoria have also run information sessions for people with disabilities.
So many of the barriers that affect people with disabilities when accessing cancer screening are actually quite similar to the barriers that affect the general population. However, for people with disabilities, they can be greatly heightened. These things include access, communication, travel and transport, and fear.
Barriers that are specific to breast screening can include the mammogram machine not being accessible for some types of wheelchairs and mobility devices. The compression of the mammogram can be more painful for some people with disabilities. And also invitations for breast screening are sent based off the electoral roll, which many people with disabilities aren't on.
Barriers that are specific to cervical screening include things like there's stigma and assumptions around women with disabilities not being sexually active, which means that GPs, carers and families may actually assume no sexual activity for that woman. As well, the cervical screening test may be more painful and not possible for some women with some type of disabilities. Whereas barriers for bowel cancer screening include the person actually not being able to complete the at-home bowel cancer screening test, and if they do complete the test and there's further investigation, actually not being able to undergo a colonoscopy.
Barriers for clinicians can include difficulties obtaining informed consent, as well as the competing health priorities of their clients. It's really important that projects are co-created and co-owned.
There's no one-size-fits-all approach, so it's really crucial to listen to the needs of the community.
Building good relationships takes time and the process shouldn't be rushed.
People with disabilities, disability organisations and self-advocacy groups know the best way to engage with their own communities.